75 years ago in 1950, Hampton County Hospital opened its doors. From those humble beginnings, our story has been shaped by the people who walked the halls, the physicians and nurses who answered the call to serve, the staff who worked tirelessly behind the scenes, and the community members whose unwavering support made it all possible.
My first experience at Hampton, I was in the 2nd grade and I had pneumonia. And my dad had pneumonia and we were both in the hospital.
I actually was one of the first sets of twins born in the old hospital. We were born, my sister and I were born in 1957. So that was actually my first experience with the hospital.
My dad was the first administrator, and that hospital opened in 1950. And I was 15 years old, and when they brought the beds and all the equipment in, I and myself and 2 or 3 of my friends, young friends, helped put a lot of that stuff together.
I had just turned 17. My father was experiencing a heart attack. My mother never drove. Therefore, I drove my father to Hampton County, and Dr. Hain and Dr. Young were practicing at that point in time. And I just remember how calming Dr. Hain was for me. He took charge. The hospital was actually, the beds were full when we arrived at the hospital. And when Dr. Hain arrived, he made certain that my dad was in a room and that he was being cared for. So that's the one that I remember well because it was so traumatic. But there have been many.
Back in February of 2023, I was admitted to the emergency facility at the Hampton Regional Medical Center, and it was for heart failure complications. And I don't remember much, but I do remember that they had to stabilize me in order for me to be flown out to MUSC in Charleston.
One of the memories that sticks out most in my mind is when I was working 11 to 7 at the hospital in the early 80s as the only RN on the floor. But I had LPNs who helped me and CNAs as well as orderlies. But one night, it was a very extraordinary night. We had 5 OBs come in. Some of them got to deliver in the delivery room and some of them got to deliver in the emergency room. But we were able to pull it off and get everything and everybody happy, and all the babies were healthy.
Well, my first experience was a candy striper in 1965. I was 16 when I started. You just came in and signed in and you passed out ice and answered call lights as much as you could, just make sure that the patient was okay. And we picked up bedpans and we put out bedpans and we did whatever the nurse asked us to do. And we had a lot of fun. The outfit was a white shirt, very similar to what I have on today. And it was a bib and it buttoned in the back, and it was red and white stripes. And as you worked for so many hours, you earned cap, pins. It was a very nice program.
My second experience was with candy striping when I was in high school. Started out when I was about 15, which was around my 9th grade year, and went all the way through candy striping every summer until I graduated from high school and went into nursing school in '75.
Well, my mom was here as a patient. My dad was here several times. My daughter, my husband, myself, and both of my grandchildren that live here, we've all been patients here.
My grandmother, I remember she was here before she passed, and I remember I was so little they would not at that time let you come in the hospital if you were under a certain age. And I had to stand outside in the bushes, between the bushes and the window, and look over the window in order to, talk with her while she was in the hospital, because now I think they let children in, but back then, if you were a child, you couldn't come in the hospital to see a patient. I was born here in 1951, shortly after it was built, but I was a lab technician at Hampton General Hospital in the early 1970s, and then I went to PA school at MUSC, and about 1978 I went to work with Dr. Harrison Peoples And of course, we made rounds and hospital visits and, you know, all kind of stuff during that time.
Got a call from Dr. Peoples, come visit us on the way home, and just on a whim we decided to. We had come through Hampton on the way to Fripp in the past and liked the town, loved the palmetto trees along the railroad tracks, and met Dr. Peoples, super nice, great guy, super smart, just such humble person. Again, horrible driver, worst driver I've ever got in the car with. But great guy, great doctor. And because of that, I learned about Hampton County and developed a fondness for it. And I initially planned to do solo family practice in Hampton. But after meeting Buck and Dr. Sheely, who invited me to come and practice with them for a few years, just to get my feet on solid ground, I did that. And it was a great experience. They were great to practice with. And we did that for 3 years. And then I went out on my own. But I all started with Dr. Peoples and kind of went from there.
Dr. Peoples was the ultimate role model in terms of all he was able to do, both as a physician, as a community leader, and as a healthcare leader, by being on the Board of Trustees at the Medical University and then chairman of the Board of Trustees of the Medical University. So he had the backing of them with whatever he, wanted to tackle here. And one story that sticks in my mind too is, and a relative told me this story, that one of the farmers got his arm caught in a corn auger, and there was no way to get the arm out. Dr. Peoples came with his big black bag, I suspect, but anyway, amputated the arm on the spot at the farm. And the guy lived to tell about it. So that's, can't get much more rural than that rural medicine. So, yep, so maybe not a real comfortable thing to envision, but he took care of it. Then, the guy probably would have bled out or died if he hadn't done that. So,
his father was a physician, and his mother was basically the nurse for his father. His name was Dr. Lee Peoples. And this was back in horse and buggy time sometimes. She would drive the car or the horse and buggy, and he would ride, and they would, they were in a rural area. They were in Scotia, South Carolina. And they would make house calls, and whatever, deliver babies at the houses and things like that. Naturally, Dr. Peoples was his son, and so he went to medical school, and just carried on that legacy. And so he saw that medicine come from that to what it is, during his lifetime. He was always, Dr. Peoples was a very assertive at technology and change. He didn't hesitate one bit to, he was to push to have computers in the area and have connectivity among the practices. He, when I was working for him, we had a CPM computer with one floppy disk to start with, and then we went to 2 floppy disks, and then we went to a hard drive. We never ever had networking at that time, and all. But I think he would be amazed today because he always was on the front of technology and loved to kind of create, technology, I guess you would say. His theory was if you don't learn to bend, you'll break. If you try to stay the way things are, then you're going to be behind, the 8 ball, and you need to always try to advance. He and Dr. Hain years ago went to, I think it was New York, to the polyclinic in New York to learn how to pin hips. And so, they went all the way to New York City way back then to learn how to pin hips, and then bring that back to a rural community. And so they were, pretty aggressive as far as that.
I was always a person that, if there was an opportunity to expand services, we had a staff of less than 80. We had 3 doctors on board. But being there for 44 years, had an opportunity to expand because healthcare was expanding. There were opportunities from the federal government to use federal dollars to look at those communities that were high infant mortality, there's so many other services that was needed in a rural community. And since we knew what Beaufort and Jasper was when we started 25 or 30 years ago, some of those same problems occurred in Hampton County. So we took that as an opportunity. I knew Dr. Peoples. He and I served on the MUSC advisory board together, and we talked about it quite a bit. So he was quite instrumental and supportive.
One of the few things that I learned when I came here was when Fried Chicken Day was, because it seems like every social event in Hampton, was based on food, especially fried chicken. So, and I was told if you want to eat on Wednesday, you go before the community gets there because they will run out. So I kind of got that ingrained in my head. And probably every Wednesday about 11:45, I'll get a little nervous thinking about that. But if I want to eat, I better go. But yeah, the hospital, when the new facility came, it was such a difference. I mean, it was just leaps ahead. The old TV dinners they had at night for the patients because they didn't have staff and didn't have facilities to cook 3 meals a day.
Every year around Thanksgiving, I would order from the dietary department the stuffing, the dressing, because I can't make stuffing and she made the best. I had asked my son-in-law, I said, come on to the hospital with me and let's go pick up the stuffing. And he said, what? He said, you don't make that? And I said, no. And it almost like ruined his Thanksgiving thinking I didn't make his stuffing. And he said, yes, I'll go with you because I want to kiss this woman. It's just so good. Oh my goodness, it's the best food in the world. At one time, I think it was the best restaurant in Hampton. Might still be.
One of my most fondest memories was the food at night. It was grits and tomatoes, and I forgot what kind of meat, but Miss Mary Peoples was the director then, and she always had enough of us to go in and have some.
And it was such a great family feeling. The hospital employees and the Harrison Peoples employees got along so well, and it was a great kind of a cohesive group at the time. The building wasn't much, the facilities weren't great, but the camaraderie was wonderful. And it was through that you develop long-lasting friendships. It was really great. Miss those times. They seemed tough, making do, but at the same time they were really wonderful.
They used to have these things called linen. It was like a frame and a bag that the linen went in. When you took off your scrubs, you put them in this bag and all. And I remember them sticking Mary Lou Hazel in that bag one time, I remember when I worked in the lab, I was going somewhere one night and a bunch of nurses grabbed me and drugged me in the emergency room and strapped me on the table and marked all over my stomach and everything, those kind of things. Everybody was always pulling a prank, so it was kind of a fun place to work. In the early years, I guess you would say, we made rounds with the nurse. When we came in, the nurse walked with us, during rounds and, basically took the orders, as we walked around and made rounds. And then as soon as we made rounds, we headed out and went back to the office to see patients. But there were no hospitalists, there were no ER doctors, at that time. They took turns. To start with, they would stay at home and be called in to the ER when they were needed. And then later on, as ERs got busier with, even more minor things, I guess you would say, they ended up having to spend the night, and they developed a call room for them so they could stay here and spend the night and be on call. And then, ultimately that transitioned into having ER doctors, but that's not that long ago that we didn't have any ER doctors and, and full-time staff.
My first job at Hampton Regional was a staff nurse. Things have changed because when I came out of nursing school, we did 8-hour shifts. Nobody did 12-hour shifts. So you either worked 7 to 3, 3 to 11, or 11 to 7. you didn't just waltz into a 7-to-3 job. Those were very sought after, and you had to sort of earn your way into a 7-to-3 position. A lot of the nurses nowadays come straight to a 7-to-3 position. That was unheard of when I came out of nursing school. You always got the worst shifts. So we have just made giant strides. I mean, we've come from an era where there was no doctor in-house at 11 to 7. I mean, I would see the patients in the emergency room. I'd call the doctor on the phone. I'd tell him their complaints, and he'd say, I'm coming in or I'm not coming in, do this or do that, to the fact that we have 24-hour around-the-clock physicians in-house.
The hospital was so close to being closed. We were down to, they were cooking TV dinners for the patients.
When you came in the morning as a nursing assistant, you stood in front of the desk and the nurses sat down behind the desk, two to a chair, and smoking and just blowing smoke everywhere and talking and getting report from one nurse to the other.
And skeleton crew, and it was a serious time.
I think Dave took a hospital that was falling down and probably didn't have but a few years left on it, if you want to know the truth.
And he was sent there to close the hospital. And he had a vision, and I'll always appreciate that. He saw the value of having a community hospital. He saw the value of keeping us open. And so he chose to defy the odds and go in that direction. And look what happened.
As he came and he was, in the community and all, I think his vision changed to try to make, a new updated facility.
When I went to work at the hospital later as chief medical officer was when I really came to appreciate some of why Dave did what he did. And he really is amazing with certain things of healthcare that I think he's got really great gifts with. So with me there, with this mouth that talks all the time, and Dave there with the brain, it was just a well-oiled machine there for a bit. And I love that part of it.
He breathed life into the hospital, and he brought about changes, and he moved us forward with a vision. And nobody wants to lose their job and their livelihood in their community hospital. So it was a breath of fresh air.
And built this big facility and kind of put Hampton on the map as far as healthcare.
Well, when I first came here, the hospital was in absolute dire financial straits, and rebuilding a hospital and concurrently building a health system from the ground up was faced with a lot of challenges. It takes tenacity, it takes drive, it takes commitment to your vision, and it takes sometimes making really hard decisions and unpopular decisions. My role here is in leadership, along with my colleagues in leadership, is to fulfill the mission of the hospital and serve the patients in the community. And for that I'm unwavering.
We looked at how much it would cost, but then we had to set that aside because quality of life, is much higher than the cost of something. The old hospital had become somewhat obsolete in what it had to offer. Even the structure itself, you're talking about 1950 from when it was built. And so you're talking about a hospital that needed a new hospital to accommodate the type of health care that the county need in order to move forward in the future.
I think there's a lot of pluses to telehealth and telemedicine, but I also think there's a lot of times that you need to lay your hands on a person to take care of them. And so, there's a need for it, but it still doesn't substitute, it's not that personal touch and personal feeling, that you have, with a one-to-one visit.
There were just so many people that interacted. I mean, to work in a facility where you've got somebody to laugh with or cry with or pray with. There's some prayerful people at Hampton Regional. And I knew when I'd get in the ditch, there were people to get me out. And I love that family, part of it. And again, I'll say that the people asset that Hampton Regional has is not to be found in the big hospital systems. So that was one of the greatest things about it. And it was across all lines of work. I mean, it didn't matter if you were dietary, if you were worked in the billing office, or if you were in the custodial staff. We all get along. We all got along. And I love that part of it. Didn't have that at the big facility. You didn't know, who was working in the cafeteria. I know who was cooking fried chicken on Wednesday, right? But at the big facilities, you have no idea. I love that small town kind of feel with it.
I think a lot of times, somebody that grew up in a more metropolitan area doesn't really understand the rural area quite as much. When you grow up in a rural area, I take care of people in the office. I probably see them at church, I see them at the grocery store. I might see them drinking coffee at Hardee's, I might see them hunting or fishing or whatever it is. And so there's a tighter knit, I guess, community, as far as that. The healthcare, has to be part of that local community, and that's one thing that having a local hospital, having local providers, makes a difference.
The kindness of the people, that never changed. One great thing about this hospital is that you're not a number, you're not a room, you're a name, and they know you. And they take care of you as if you're family, their family.
Over the decades, we've seen medicine evolve, technology advance, and a new facility rise to meet the needs of a growing region.
Our affiliation with MUSC has really made a significant change in healthcare in rural areas.
I think that it is a game changer. I mean, the access, local access, makes a big difference. If people can get care in their hometown, it cuts down on the frustration of having to go out of town to get care. You feel better. And if there's someone that you know that's been through the service, it's a plus.
I think it's an important part of who we are now. I think that it's valuable that we have an affiliation with MUSC. They can share resources with us, and it makes it easier to transfer patients and follow up with patients when you've got the connection there.
The ability to do telehealth has actually made us be able to treat way more patients closer to home, which for a lot of your elderly patients is vital. So it's made a huge impact on our patients to be able to, through telehealth, to see specialists, find out what they recommend, begin treatment here.
We're going to provide the highest quality health care that we are able to, knowing that we can't provide all health care. That was one of the reasons for our affiliation with Medical University, to have those resources available to the community that are not easily accessible here.
I believe that this hospital is such an asset to our entire communities. We're in a rural area, and unfortunately, currently, in communities that are in financial crisis. And in order to have an asset like this, where there's local health care in a rural, distressed area, and the facility is expanding, it's a huge asset to the community, and it has saved multiple members of my family's lives multiple times.
I would have never dreamed when I started nursing in 1978 that we would ever be to the point that we have pretty much everything at our disposal. In the old hospital, we used to say necessity was the mother of invention, because we didn't have the things the big hospitals do. But now we have a large portion of what even MUSC has. We have the huge ER, which serves a lot of people, and we're even adding on to it, which is going to give us even more room.
We've got about a 6,000 square foot expansion of our emergency room. That will include complete renovation of the existing emergency room. In addition to that, we've got some pretty big capital expenditures and overhauls going on in the operating rooms, upgrading of all of our sterilization equipment and surgical equipment and lights. And I think it's unique that we are still an independent hospital. We do have a very strong affiliation with the Medical University of South Carolina, but our governance and structure is that of an independent, not-for-profit community hospital with a local board of governors or trustees that help shape the direction and decisions that are made here at the hospital.
Yet through every milestone, one truth has remained constant. Hampton Regional is more than a hospital. It is a cornerstone of community, rooted in history, committed to today, and always innovating for tomorrow. These are but just a glimpse of the memories, the milestones, and the people who built Hampton Regional Medical Center. This is a nod to our past, part of our story and our promise for the future.